any case, going back to assessment of conflicts. And it says here at the beginning, if you have it, page 35, that our behavior is governed by many factors, but the ones that we are referring to here, because are the ones that we are considering, is the interplay of internal forces in the personality with external forces, the interaction between these two things, which means, for example, your impulses on society, your impulses and it depends on the stage at which you are. If you are a child, your parents' prohibitions, you can do that, you can do this, and things like that. If you are an adult, it's the adaptation of the society in which you live, then it is not your parent who said, that is a no-no. It's the law and the court and all of that. That's why we have courts and jails, and it's to help those that cannot control the behavior otherwise and to punish them that transgress the norms of the culture. It's not very different to what happened in children. With children, it's the parents that become the judge and the provider of the punishment. When you get to be an adult, we have developed the mechanism to substitute for that. Or, so much of human behavior is then governed, and that's the part of human behavior that we are interested in because it's caught in conflict and is determined by conflicts. So it's an interplay of internal with external forces, or of internal forces, conscious or unconscious, with each other. In other words, think structurally now. Ego against the id, superego against the id and the ego, conflicts between ego ideals, things of that kind. And this determines a lot of the behavior that we will manifest at any given point in our life. We don't necessarily know that we are driven by these forces in directions that sometimes, in dramatic cases, is not even in our best interest, but just the opposite, and yes, we're driven there. So, we have to look at the conflicts. And you remember what we said. Conflicts may involve, at the very least, two forces in opposition to one another. But sometimes it's several forces in opposition to something, or several forces on both sides in conflict with one another. And we are, of course, referring to neurotic conflicts here, the ones that we can treat. And as you remember, one of the conditions of a neurotic conflict is that one of the elements of the conflict needs to be not known to the person. Otherwise, what you have is a problem or a decision to make. If you know the two factors involved, then it may be a very difficult decision to make, and you may have a lot of trouble making it. But there is nothing about that situation that you are not aware of. It's just a difficult decision to make. What we are talking about is a different situation. It's a situation where there is a genuine conflict in which one of the aspects of the conflict is not known to the person. He knows the other side of the conflict, whichever one it is. And it's not necessarily that the aspect that is not known is the impulse. Frequently, that's not the case. What the person doesn't know knows the impulse, but ignores the commands of the superego, or says, oh, no, that's not a problem. You know, like adolescents do, you know, they masturbate and so on. They know that they have an urge to masturbate, and in their attempt they say, oh no, I don't have any problem with this and so on, you know, and yet they are enormously conflicted and restricted and inhibited and so on. But they are not aware that they are being caught in that conflict. They are aware of the drive, they are not aware of the superego prohibition. In fact, they are denying it in words and in action. So as you see, these conflicts take many shapes and have many faces. And you remember we have talked about a large variety of different type of conflicts, and how important it is to describe with precision. Just as I told you last time about the fixation point, that it's not good to say, oh, he's fixated to the end of a stage. That's good, but it's not good enough. All right? Here is the same. Now, so you want, in terms of the conflict, you want to actually, if it was possible at all, to say whether the conflicts are with the libidinal drive, the sexual drive, or with the aggressive drive, for example. And once you have done that, or both, on occasion, the conflict is with both aspects of the instinctual development of the human being. So, on occasion is both, as I said, and then you have to, once you say, well, it's with a sexual drive, for example, then you have to be, that's starting to define the problem, but it doesn't define it very far. So you have to say, well, what phase of drive development are you referring to? Is this at the oral level? Is this at the anal level? Is this a phallic-digital conflict? Where does it belong? What phase does it belong to? And that's better. That's a step further. You're saying now not only is a sexual drive, but it's a sexual drive in this phase or that phase. Once you say the phase, that's better, but it's not enough either. Then you have to look at within the sexual drive organization, if it is with the sexual drive, and within that phase, you have to look at which of the component instances of that phase are the ones that are causing the situation of conflict. And until you know that, you really don't know what is happening. You are getting there when you say, yeah, it's in this phase. But if you leave it there, it's like being in Tampa, but you have to visit somebody, but you don't know what street he lives, or you know how you get to that place. And this is exactly the same situation, yeah? So it's good to be in Tampa if you want to see somebody there, rather than in Jacksonville. But that won't take you where you need to go. So you have to, as you see, train yourself to think in this particular way. And it is not that difficult. If you have done a profile, I told you, this is a way of thinking. The profile has forced you to do this thinking already. So you know which phase of development may be involved. And within the phase of development, we have talked about the component instincts of the phase of development. So you have all of this information. You have already looked for this. Here, you are rounding it up in terms of conflict and how that affects human behavior. Now, let me tell you to, once you have done that, you are in business, some kind of better business. And you know really what you have to address. Obviously that has enormous value, diagnostically, in the prognostic sense, and therapeutically. You know what you have to address. Now, on the other hand, as you know, conflicts are in a sequence. As I have told you in the past, you are not born with conflicts, psychological conflicts. You have absolutely no objections to any of your instinctual impulses. That's the kind of animal you are. You just manifest your impulses as they become activated, whatever it is, you know. And so, as far as you are concerned, for a long time, while your cognitive development and your awareness of the world around you and the objects that populate that world and the importance of those objects and your attachment to your primary objects doesn't become well established, you really have no understanding of what the problem is. If you take a baby, 3 months old, and he defecates, and the mother gave it upset, shouts, he had no idea what is happening. He just passed bowel movement because that's what his body tells him to do, you know. So he'd be completely lost. Now, if he's 14 months, 12, even 12 months, 13, 14, 15, 16 months, he will start to correlate the mother's anger with whatever it is that he did, and so in a way he's starting to have an awareness. When that object has enough importance, then he has an external conflict. He himself has no objection to his body products, but his mother does. And he is now dependent on his mother because she has become his primary object, or her primary object. So the conflict is now between the instincts and the external world. And in society, civilized society, we have to control a large number of our impulses, and we can only gratify some of them under very restrictive norms that our culture and our society and the rights of others impose in our behavior. And that we are not born that way. We have to be taught that that can be done in this way, that cannot be done in no way whatsoever. If you do that, you get into real trouble and things of that kind. So what I'm trying to tell you is that as human beings develop, the conflicts that are with the external world, to start with, become internalized. And at the beginning, the conflicts are just between your drives and the external world, whatever type of drive it is, whether you are biting another child, or biting your mother's breast, or biting her ear off, or whatever it is that you're doing, which is not acceptable, or moving your bowels in the wrong place, or being in the wrong place, or whatever it is at the wrong age. That simply is not acceptable. And we start to say, no, you have to adapt to the demands of our society and our culture. Clearly, every family differs a little bit from the next family. Some people be more tolerant about this and less tolerant about that because it has to do with their own psychopathology. And that will influence how they handle the children's impulses. Whether they are very rough about it or they are gentle about it. And some people tolerate certain things very well, and yet other things they get very upset about and will clamp down on that child real hard. And so, and all of that is starting to define who you are. That you can do and you cannot do kind of things. As you know, from that process, and when these objects become significantly important to you, and in the cognitive sense of the word, you're aware of what they want from you. If you have not reached the point in development where you can recognize what it is that they are requesting, you cannot do it. That's what people that is trying to train a 9-month-old baby not to defecate in his nappies are crazy, because he can't understand what it is that they want, nor does he at that point have the physical ability to control his sphincter. He still has no myelin, and his pyramidal waist down enough to be able to control his impulses. But at some point he will, right? And then, if he has sufficient awareness of what the mother wants and the ability to control his sphincter, then this conflict with the external world has to be resolved. The question is who will win, the drives or the mother? And you know that most people get totally trained, so the mother usually wins, and that's a good thing. In the same process though, these things that are prohibited out there and we resent, we don't like this because we like our drives. So we struggle against it, and how much you struggle partly depends on how punitive your parents are, how strong your endowment is in relation to these particular forms of expression of some of your drive. We are not all born in a tabula rasa, which we all have all the same oral needs, all the same mental needs, or the same strength of our phallic impulses and so on. Obviously there are differences that are genetically determined. In any case, what happens is that we start to introject these things, and all of these things that we are being taught by first our parents and our teachers and the culture at large, and all of those that influence our behavior becomes a precipitate that forms a conscience. And at that point, when you have acquired conscience, that means the superego, then the regulation of your drive is no longer between you and the external world, it's between you and your superego. They are now internalized, the authorities are inside your head, they have the capacity to make you feel very bad when you transgress and things of that kind. And finally, for most people, not for all people, there are exceptions to all rules. Psychopaths, genuine psychopaths may be exceptions to these rules. They may not have introjected the demands of the culture. And sometimes there are good reasons why that is, because the culture and the immediate family may be in a clash. If you are in a family of thieves and vandals, the culture doesn't like that, but that's what you learn. And you may not introject the standards of the culture that comes much later. You introject the standards of your primary objects. And so you have not acquired restrictions in that type of behavior. In fact, that's what you do. Now, if you acquire superego, though, these prohibitions then become your own. And as you know, one's self-esteem is then regulated not by what people out there says, but what by your conscience tells you. All right? More significantly, if you are mature enough, though you always pay attention to what people out there says, you should be able, when your conscience tells you they are wrong in their request and you are right, you should be able to say, I love you very much, I like you a lot, I wish you like me, but we have to disagree and I'm going to do it according to my own objective judgment and criteria. And we, you know, it's when you say to a friend, we have to agree to disagree, all right? You go your own way. Some people cannot do that. Some people cannot do that, which means that they are too dependent in the object world to regulate themselves internally, their own self-esteem and their own self-regard. In any case, when you have put all of this inside you, these are then internalized conflicts. And then the conflicts are not between your drive or your ego and the external world, but between the id, the ego, and the superego. The external world always plays some role. It's as I told you, as a backup system. Yeah? If you can control your behavior, let's say you're aggressive, destructive, wishes towards somebody, and you think that you want to kill them or something, you can control it. You say, I can go to jail, the police is going to cut me, to catch me, and in Florida that means sitting in an electric chair. And you may say, hell, I'm going to do this. I better leave town or go on a vacation or cool off or take a shower or do whatever I can to control the behavior. Once, of course, all of this is internalized, then for most people, within reason, all of these regulations don't require external authorities. You can do this internally. You have not only introjected the do's and don'ts, can do and cannot do of your culture, your community, and your family, you have at the same time become empathic. You can put yourself in the place of the other person. You may start to think, I wouldn't like that done to me, I'm not going to do it to anyone. You have a sense of what is fair and what is unfair and so on. And all of that will contribute to regulate your behavior. You remember that a little while back, in fact last week, I was talking, no last week, the week before, talking to you about the different ways that the superego is structured. And that in present day society, given the amount of knowledge that most human beings can acquire, that was not the case a few years ago, and the fact that communications are so fast, and you can be a witness to events in the world with your eyes, so nobody can tell you a story, and it doesn't happen you confronted with it. The impact of that is enormous. It's not like when you read in the paper 3 months later, you say, well, it already happened 3 months ago. Hell, who remembers what significance it has? See, it's happening in front of your eyes. The impact of that is very different. But all of these things play a role in what kind of internalized conflicts you do have and how you develop your superego and what kind of a structure, and do you follow blindly the patterns of your cultural group and your family, or do you develop your own objective criteria as to what is right, what is wrong, what is acceptable and what is not. And you remember that we were discussing the other day that has enormous benefits. At the same time has created some problems because these structures that were followed blindly tend to regulate society in a very strict manner. And this amount of freedom creates some kind of room for chaos and enormous difference of opinion and behavior in social groups. So the internalized conflicts are between ego, superego, and id. And thus, as I told you, after the ego agencies have taken over and represent to the id the demands of the object world, to the introject, and that arouses guilt or shame or a variety of other affects when you fail to comply with this introject, with your own court and your own judge in your own head. All right? So you look at these conflicts, and you already have that information in the profile. You did look, at the fixation points, you did look at the defenses, you did look at what the defenses were used against, what was the impulse that was being defended against. You have already a lot of information in your head. You are organizing it a little differently in the structural sense of the word. What parts of the structures are caught in this conflict? You remember the metapsychological points of view, the dynamic point of view, the economic point of view, the genetic point of view, and the topographical or structural point of view. Well, you are organizing your metapsychological approach to the same data. You are making it more complex, more meaningful. You are going in depth in your understanding. Now, in human nature, there is a very interesting phenomenon which is typical of human beings. And it's another group of conflicts. We have talked of a state conflict with the external world, conflicts that become internalized. The original conflict with the external world become internalized. And so these are internalized conflicts. And there is a third group called internal conflicts. Internal conflicts, I define them for you in a moment, but let me go back for a minute. Remember, I told you that some people doesn't internalize for whatever reason some of the things that are typical for the culture in which they live, and so they are deviant from the behavior of the culture. In fact, they behave in ways that are normal for the social group but are not normal for the culture, and so they get into an enormous amount of trouble. Because we tend to be pejorative and think that those of us that do it in a certain way, which constitute the majority, are on the right, we call them delinquents or psychopaths, and they are. They are behaving in ways that are not acceptable to any civilized society, but we totally ignore the fact that, that the solution, the given environment that they have, they were able to reach. They are not doing that to get us, to get our goals. That's the way they grew up. And growing up is not an automatic procedure that always guarantees the product at the end. It depends on the culture, it depends on the primary objects, it depends on the interactions between genetic forces and the environment, and the developmental experiences of individuals. So some people doesn't have the introjects that go with the culture, and so they are deviant. Other people have acquired them, but we have defense mechanisms that allow us to throw them out again. And when we externalize, yeah, and use projection as a mechanism of such type, we are saying, I don't have a problem with it, he has a problem with it. You put it in somebody else. And you see, then it looks like an external conflict, because the person is not recognizing that as his own. He's saying that he is the problem, or she is the problem, and this is the problem that they have. I gave you an example of that in relation to bisexual conflicts, for example. When we talk of the defenses and internalization and projection and things like that. Whatever the reason why that happens, that person will give you the impression that the conflict is not an internalized conflict between the structures of the mind, that is the id, ego, and superego, but between the id and the external world. But that's false, because what that person has done, this is an internal conflict, internalized conflict, that he had externalized, thrown it out again. And that's very different from a genuine conflict with the external world, because that one means that the introject doesn't exist. The other one means that it does exist, but there is a way to bypass it, and this person is using that. You see the difference? All right. Now, the internal conflicts are called, just like the internalized conflicts are called intersystemic, between the system, between the ego, the id, and the superego. The internal conflicts are called intra-systemic conflicts. That means that they are conflicts within the structure itself, not between the structures, but within the structure itself. And that is a characteristic of human nature. And I tell you what is meant by that. We can love and hate simultaneously the same person. It's called ambivalence, right? Love and hate. Now, in our id, contradictions don't exist, so love and hate can be happily together, and indeed they are. We hate all the people that we love, in case you didn't know that. What degree you hate them to is a different issue, but don't think that you only love them. That's not true. Sometimes you may hate them more than you love them. Whatever that may be, or be that balance as it may be for whatever reasons, the fact is that we are, by nature, human nature is ambivalent. We can, and it's based on that capacity that we have to love and hate the same object. Now, usually, normal people cannot love and hate at the same time, because once it goes through the ego and manifests itself into consciousness or behavior, your superego will say, no, 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 you can't do that, all right? And there is a clash. Only psychotic people can love and hate simultaneously in consciousness and object. Otherwise, most of us will have to repress or exclude one side, be that the love or the hate, and feel only one of the affects, because we can tolerate feeling love and hate in the same intensity to the same object at the same time. That will be completely devastating to the ego. So we dispose of one of the two sides according to whatever the situation is, and that's the way we function. So that's one type. We are born with a tendency to activity and a tendency to passivity. And again, that's intrasystemic. We tend into both directions, and we can do either, and frequently we don't know whether to do something or not to do something. And human beings obviously differ in the amount of ambivalence that they are born with, yeah, and the amount of activity-passivity balance that they are born with. Some people are born that from the moment you see them out of the uterus, they are all over the place. I mean, it's not a quiet baby. It's a baby that moves like hell, and as he grows and develops, will raise holy heck, because he has a lot of going in. Others are very quiet, and that's a genetic given. Now, is it only a genetic given? Yeah, that's the way it starts. Then certain things that happen in development may favor the one response or the other, or repress one of the tendencies and favor the other, and then what you see in the older child or the adult person may not be quite the original picture, but the original picture is there somewhere, you know. So that's the other set of opposite tendencies that live simultaneously in us. The third one is bisexuality. We are all bisexual. And we discussed this earlier. I think that we are bisexual for many reasons. And that is, we love both a man and a woman in the form of a father and a mother. And that's the way we start life. And we know, for anatomy and biology and so on, that we are bisexual. Men have feminine hormones running on them, and women have testosterone running on them, and things of that kind. Indeed, from the embryological maturational point of view, we are all born of a matrix which is a feminine matrix. So that those of us that became males, it happens because for genetic reasons, the XY chromosome reasons, and certain endocrinological hormonal baths that we have at certain types in the development of the fetus. It will change whether that feminine matrix will be developed into feminine sexual organ or masculine sexual organs. So bisexuality is another of the internal conflicts. Why is it all this important? Well, because all of these things are like adding fertilizer to the ground in which certain type of plants will grow. See, if you have, let's say, think of bisexuality, and your bisexual constitution is not well defined, things that happen in the environment may push you easily in one direction or another, be that a homosexual outcome or a heterosexual outcome. In other words, it becomes kind of fertilized ground for the neurosis to develop, you know. And the same is true of the active-passive conflict and the love and hate conflicts. All the things that happen during development kind of fall, is a seed that will fall into this ground that may be fertilized in this particular way and will allow certain things to grow stronger, faster, and more difficult to deal with than if we didn't have these tendencies in us. So, unsolved ambivalence, activity versus passivity, masculinity versus femininity are the three typical internal conflicts that favor the development of neurotic conflicts on that ground. Now, you, let me see. As we said earlier, you have to clearly, whenever you're talking of external or internalized conflicts, you need to define whether it is with the libidinal, with the aggressive drive, and then with the paces and so on. Now, so you have to make reference not only to the level at which the conflict is taking place, as I said to you earlier, but to the specific component issues that are involved, where they are phallic-oedipal strivings, where it is oral aggression, anal sadism, looking, scopophilia, whatever it may be. And are these the only conflicts? No. There are some more. There are conflicts, as you know, which we have talked about before, between ego ideals. You remember? There may be two very different ego ideals, or different superego ideals. And that too, in a manner of speaking, is like intrasystemic conflict, though obviously the other structures partake in this conflict, which is not necessarily true of the really three most important internal conflicts. What is it that I'm trying to say? Well, we talked about this already, so we don't need to go too much into it, but you remember that I mentioned to you that, for example, when in the normal conditions in this country and in most civilized countries in the world, we accept the fact that we have to respect every human being's life is as precious as ours, that we are all born equal, that God makes all the same, that we are not bigger or greater or more deserving than anybody else, and that we should treat people the way we like to be treated. And that's all fine and dandy. That's what we all are taught by. You have reasonable parents, your school, and the culture, the constitution of this country says that, and so those, you know, in one way or another, the culture and laws of most of the civilized countries. Yet, if something happens that leads to war, you are suddenly told the opposite. Say, go and kill as many as you can. These are not your brothers and sisters. These are your enemies, and you need to kill them. Now, that's not easy. Once your ego ideals are one of brotherhood and all of that, then suddenly you are thrown into this very difficult situation where you have to take a rifle and start to shoot people that are like you, and you know that they have wives and children, brothers and sisters and mothers and fathers, and that's not easy. A lot of people can do that. And that has a lot to do, as you remember when we talk about these things, with traumatic neurosis, particularly the type of war neurosis that is not at all uncommon. To that is added, as you know, that when you are in that situation, then you yourself have become an actor in that play, and your life is now in danger. While your life, as long as you behave in a reasonable fashion, in any civilized society, was guaranteed to you. Nobody will try to kill you. Only in abnormal, extraordinarily abnormal circumstances. In a war, all of that changes. And you are trying to kill people that they say they are your enemies, and they may well be. But it's very difficult to accept that for a lot of people. And you may be killed by these people that you were told that were your brothers, only that they were living in a different part of the world and they had a different culture. And they will kill you if they have a chance, because that's the nature of human beings. That's the result of aggression, and that's a result that frequently we don't know how to resolve our conflicts by other means than by force. And unfortunately, until we evolve some more cultural, in whatever way we need to evolve, that is going to continue to happen, because it's very difficult to control some of the impulses that are behind the forces that lead to these clashes, you know, which may be difference in the culture, may be economic interest, may be social difference, religious differences, all of which can be at the basis. But obviously, just if you have religious difference, you are not going to kill anybody unless you had aggression, you know, and can build up in your own mind the idea that these people needs to be eliminated because they are of a different religion or race or whatever it may be. So all of these interactions makes a human being. And this is what you are looking at this point. And you have already looked at the ego structure and the superego structure and the defenses and the fixation points and so on. So you are not trying to put it together in terms of describing the conflicts in great detail. If you do that, you have done well. Now, on the other hand, and according to the predominance of any one of the three types of conflicts that we described, conflict with external world, internalized conflicts, internal conflicts, then it may be possible to arrive at the following assessment. The level of maturity, that is the relative independence of the child personality structure. How far is he now self-sufficient in controlling his own behavior and dealing with his own life and gratifying his own impulses within the norms of his culture and things of that kind. And that speaks to the maturity of the human being. So immature people cannot do that, you know. Sometimes because they simply are psychologically immature. Sometimes, like let's say a mentally retarded person, because they don't have enough brain to integrate cognitively these concepts in such a way that will help them to understand that they cannot do that, you know. Whatever it is, the end product is the same. Obviously, it will tell you something about the severity of the disturbance. These conflicts, at what level, with what component instinct, between which structures, how much of it is determined genetically in terms of your imbalance in love and hate and activity, passivity, and bisexuality. All of this will determine, you know, how well you go put together, you know, through the interaction of the many forces that go into development, and how severe are you lax? How severe is your disturbance? How far behind you were left in development? Obviously, if you know that, you have a better idea of what type of treatment you need to use, what you will have to do, and whether this person needs more frequency, less frequency, whether they can tolerate regressive states, whether that is to be avoided because they are too immature and too unable to control themselves, and if they become very regressive, they are in danger, you know. And so these are people that you're not going to put in a couch, because a couch induces regression, right? And it's regression at the service of the ego. But these people, if they have these kind of problems, are not going to be able to keep that regression within a reasonable amount of control. And so you may do more harm than good. So you see, you have putting all of these things together so that you know what you're going to do now, next. Now finally, he says here, the intensity of the therapy needed for the alleviation or the removal of the disturbance. In other words, can it be removed? Or you have to be contented with alleviating the disturbance. Obviously, if you have all this knowledge that I have been telling you, you are in a much better position to say, yeah, we can be ambitious and treat him in that, or just, hey, don't go there, just keep it so that it's functional and so on, but there are lack, there are defects in the development of the structure, there are experiences in this personality that cannot be undone and cannot be changed, and you are never going to get past that point. That's rock bottom, okay? Now, so that's what you do. Then you go to the last section here, which again we have discussed in the past a little bit, I think, though perhaps not in great detail, and it's what is called assessment of some general characteristics. And they involve 4 group of things that you have to look at. One of them is the frustration tolerance, the level of frustration tolerance of the individual. One of them is the capacity to tolerate anxiety. One of them, the third one of them, is the capacity to sublimate. And the final one is some kind of general assessment of what is called, if you take a balance between the progressive forces in the personality of the person that you are assessing and the regressive forces that you observe, where does that balance fall? Now, this is very important in treatment. You need to know these things for many reasons. I tell you some of them. Let's go to the first. Incidentally, most of these things are givens. That's the way you were born. Some people are born with a high degree of tolerance for frustration. Other people have very little frustration tolerance. Sometimes that depends on things that are added, to whatever it is genetic and inborn. For example, if you have ADHD, you have absolutely no tolerance for frustration. And, you can't wait, you have to be now or yesterday better than now, and things of that kind. But that's an added complication to whatever it is that you see if you are going to deal with this in psychotherapy. We're not looking at what was added. That's important. Here, it's not that it's not important, it is, but here we are looking at the givens that are the basis of the personality, not that was added by illness or God knows what, but what is the basis of it. Now, when you look at frustration tolerance, you have to look at three different. The best way to do this is to look at, not to do it in general, because that's very difficult to do. What you do is you look at the frustration for the tolerance of, at the tolerance of frustration of the sexual drive, the tolerance for frustration of the aggressive drive, and the tolerance of frustration for what I call neutralized activities, which doesn't necessarily involve significantly either the sexual or the aggressive drive, but are things like schoolwork and so on for children, workplace for the adult, and the ability to sit there and put up with it and take, the comings and goings of being in a job and having to deal with other employees and your boss and the demands of the job and this and that and the other. If you divide it that way, then you get a better feeling. But here you have to do the same. If you say, well, he has low frustration tolerance for the lack of gratification of the sexual drive, which is common in people. Some people get very upset if the sexual drive is not gratified. They really blow their tops easily. You may know some of them. I hope you don't have a partner like that, but it's possible. In any case, you have then to describe, if you can, as we did in the phases of development, is there a difference between the frustration of oral sexual activities or phallic activities and so on? So what I'm trying to tell you is that you have to become as precise as you can. When you say, yeah, he gets frustrated if his sexual impulses are not gratified, that's good to know, but it's not good enough. You'll be wiser if you can say, particularly when it refers to this, that, or that, and no other activity of the sexual drive. And people, believe me, gets frustrated very different to very different component instincts. They may have a lot of tolerance for the frustration of certain of these component instincts, very little for the frustration of some others. The same is true of aggression. What phase of aggression, and within that phase, what tolerance? And then neutralized activities, which is what I told you. For the children, is in the school, having to do homework, which is difficult, and then they throw everything into the air at the slightest difficulty and so on. You can see that. Or people, adults, in tasks that are the responsibility of adults, like the workplace and so on, and where you see the same kind of reaction. So it is very important to look at all of that. And as I said, many of these, this is always genetic givens. But again, development overlays some of these things, you know. And so what you are looking at may not be the original disposition, but the disposition that has been overlaid by certain conflicts. Now, if you know that to be the case, and you know, for example, that the child was doing okay until he was 11, and from there onwards shows low frustration tolerance, you go to the previous stage, and that will tell you what the baseline was. What you see at 12 is the baseline distorted by the conflicts, which now show in a way that may be misleading. That's important, because if what you find is that before the conflicts he had a good frustration tolerance, you have a much better patient and situation to deal with than if what you find is that the frustration tolerance even before that was low and poor. The lower the frustration tolerance of people in any of this area, the more prone they are going to be to have emotional difficulties and not to be easy to deal with. We move now to the next one, which is, some people confuse them, but they are very different. This is the capacity to tolerate anxiety. That's different than the capacity to tolerate frustration. Anxiety is a specific type of affect that is triggered off in a variety of different situations. It's common in life. There are many situations in life that are bound to produce anxiety in people. And clearly those that have little tolerance for it will go down the drain a lot faster than those that can contain it, face it, suffer it, and struggle with it. If they, as soon as they see the face of the anxiety, they run away. You have a problem with this patient. They have a problem with themselves, you know what I mean? Because they cannot stand the pressure of life. And life is full of pressure. Life is full of situations that trigger anxiety. Life is full of disappointments. And so that's a different issue than the frustration tolerance. This is strictly anxiety. Yeah? Nothing to do with the drive, nothing to do with the sexual drive, nothing to do with the aggressive drive, nothing to do with neutralized activity. It's situations that provoke anxiety. If your patient gives you a story that you will elicit very easily, in fact, it be part of what he tells you, and you will see what happened. Let's say that, I don't know, he got sick, had to go to the hospital, and that obviously an anxiety-provoking situation. He became devastated and depressed and suicidal, and couldn't go to work again, and things of that kind. You have a problem. The person has a problem. If he faced that and kept himself together and did the best he could do in the circumstances to find an answer to the situation that provoked anxiety, you have a much better ball game in the park. You understand? That's a better patient. It's a patient that is more willing and more capable to face anxiety than a patient that will run away from it. Okay? And obviously that has value. It's not 100% absolute value. These are indicators, and you can be misled by them. But it's obviously better when people can do that than when their style is to run, not to face, not to try and master, not to try and control the situation, not to try and keep the head above the water, but they run, they drown, they collapse, they become depressed, they are not able to keep themselves in the right place. So you look, when you're looking at the tolerance for anxiety, you look at a variety of things as well. First of all, you look at the tolerance that they show. And again, you have to be reasonable. Yes, if you have somebody who is in an extremely dramatic, traumatic situation and they become very anxious, you cannot judge by that experience. All right? Because that's not typical. You'll be making a mistake in judging that they don't have the ability to cope with anxiety, because these were extreme circumstances. So you don't go just by one observation, you look for several things, that you have some certainty that the conclusion that you are arriving at is tenable in the face of an examination of the personality in several different circumstances, not only in dramatic, traumatic situations, okay? So, you look at the defenses that people will use in terms of dealing with anxiety, and as you know, defenses come in many sizes and shapes and colors. And some of them are very constructive, and some of them are very maladaptive and have a very high price. And that will tell you too how hard the struggle is going to be for that patient, because in treatment they will have to face a lot of anxiety. They will have to reactivate a lot of things that may not be pleasant and may be very anxiety provoking. And by the same token, that you have some idea how difficult that is going to be for this patient, and can they really tolerate it? Do they have the resources to go through this with some support and help, and obviously using your best soft gloves, you know. But then you have as well an idea of the magnitude of the task that is in front of you as a therapist, and you may aim high. If you think the person has the resources, you may have to lower your goals if you don't think that is the case. Okay, so you look at the defense activity against anxiety, and then you look at what kind of mastery do they achieve. How do they deal with the situation? What is the end product of it? What did they master this? And so how? Obviously, people that are resourceful, face it, find ways of dealing with it, use adaptive, defensive, and finally master the situation. These people have strong ego resources, which are going to serve them well all through life, and indeed are going to serve them very well under the conditions of whatever treatment you choose. As you see, many of these things that we're examining now have value in the prognostic sense of the word, and have value in the diagnostic sense of the word in terms of what type of treatment are you going to choose for this patient. Now finally, but the third point is the child or the adult sublimation potential. That means, is he able to accept substitutes? That's what sublimation is. You accept a substitute. And usually it's very rewarding, because as I told you, it's a socially acceptable change that brings rewards. Now, not every human being has the same capacity to sublimate. That requires a certain type of ego and certain type of ego skills and abilities. And some people have that facilitation. Obviously, this is related in some form to talent, whatever we mean by talent. People that has more talent and more activities that they enjoy and like have more avenue for sublimation. If you like to read, if you like to paint, if you like music, if you play an instrument, if you are a writer, if you ride horses, if you are a good swimmer, whatever it may be, the more skills that you have and you can engage in, the more likely it is that your avenues for sublimation are many, and one of them is going to do the job for you. You understand what I mean? If on the other hand you have a restricted personality, with little or few interests, not much brain power, your ability to sublimate is not going to be there. You take patients with massive, severe conflicts, low frustration tolerance, no capacity to sublimate, you have a problem. The patient will have a problem. Now, are they untreatable? No, I don't mean that. They are treatable, but they are not treatable by uncovering psychotherapy. You have to use supportive techniques and a variety of adaptations to it, cognitive ego reinforcements, you know, whatever it is that you can bring to bear, but lying down in a couch, doing some regression, controlled ego regression, is not for them, you know. So as you see, the more potential there is in that person, and we are all very different that way. Unfortunately, you cannot go to the grocery and buy a pound of sublimation. You either have it or don't have it, you know. It's, so, now remember that with any other things, the sublimation potential of an individual may be blurred by the conflicts that he's having at that particular point in time that may mislead you. So you have to look past the conflict and ask, before they became sick this way, tell me, what kind of interest do they have? What did they do? What did they enjoy? What skills did they show? What activities did they engage in? What groups he participated in? What sports did he play? You know, you find all you can about them, because all of that is giving you avenues that you can use when you lift the defense activity against certain impulses. You have to direct that impulse into something that is socially acceptable. And if you can change hate into altruism, that patient may well have solved the problem, you know what I mean? But he had to have the capacity to do that, you know, to sublimate that way. Okay, so you look past the present situation of conflict that may distort, you know, the real picture of this person. Always look past the conflict to a stage where the conflict was not as visible, as overwhelming, or had not established itself. Now, and this last point is one that Anna Freud had a particular way to make it clear, and I almost get to make very difficult things clear. So I just thought, oh, but I knew that. That was a common response to reading a paper or hearing her. People would say, oh, but I knew that. And of course I didn't. If you thought about it, you didn't. But she put it so clearly that it was obvious that that was the way it needed to be. I can't do that though, not with this particular part anyhow. And this is called progressive versus regressive developmental forces. Again, these are innate givens. And like sublimation, you can buy it anywhere. You either have it or you don't. And what balance you have between the progressive forces and the regressive forces is extraordinarily important. Progressive forces are things that move you forward in spite of difficulties that come your way and face you. You do the same thing that you do with a matter of anxiety. You don't turn away and run. You face them, you try and use all the resources that you have to try and produce a reasonable solution to the problems that you are facing. What the balance is very different. She used to give an example for children, which I never forgot because it makes things very clear. And she said, well, imagine, we were in London, of course, and in London at about 3 o'clock in the winter it's dark, so it gets dark very early in the day. And I remember, I forget whether we were at her house or at the clinic, one of the buildings of the clinic. And she looked outside and said, you see, it's getting dark. Imagine that the children are having a party in the house, somebody's birthday. They are playing back there, and one of them says, I saw a ghost. And so everybody runs back to the house. And some children will run all the way inside the house to the mothers. Other children halfway will stop and look back and say, where is the ghost? And they will move there. And some of the children will go and look back, stop in the middle, and then say, I'm going to go and see where the ghost is. And they go back. Not that they are full of courage, they are frightened, they are willing to run back again. But they are willing to go and see what is that ghost, and where is the ghost, and what is the danger. That is a progressive developmental force. The other one is a regressive developmental force. And if you have a balance on the side of progressive things, obviously you are going to deal with the vicissitudes of life in a much better way than if the balance is on the side of the regressive forces, because then what you do is that you become regressive, you run away, you don't face it, and so the problem can never be solved. You just run away from the problem, and that never is helpful in psychotherapy. Psychotherapy, people have to take a stand, and deal with the anxiety and face the situation. In reality, in most cases, though people are very frightened of it, once they do that, they are a lot better for it, because they finally can put a handle on something that otherwise is having them running for the rest of their life and is scared for the rest of their life. Once you look at these children do and say, let me see what the ghosts look like. Maybe there is nothing there that you need to fear anymore, But if you don't face it, you will never know. You understand what I mean? So let's stop it there. It's